Good afternoon and good morning to you all. Welcome and thank you for joining us on today's webinar, one in a series of COVID-19 related webinars focusing on workforce and the devastating levels of unemployment. My name is Assemblywoman Maggie Carlton, and I am proud to serve in the Nevada State Legislature, where I've served for 22 years. I am also a co-chair on NCSL's Labor and Economic Development Committee, and I will be moderating the webinar today. Amid the COVID-19 pandemic and the new wave of unemployment numbers showing us last week at 1.9 million and an 11-week total of almost 40 million people having filed for unemployment, state lawmakers face an unprecedented amount of attention on getting Americans back to work. In my home state of Nevada, we have the highest unemployment rate in the nation, which is currently at 18%, or 254,000 jobs. In the Las Vegas metropolitan area alone, the unemployment rate is 33.5%. Thankfully, the casino companies have begun to recall the furloughed workers after the governor had closed the casinos and the schools. They just resumed their work yesterday on June the 4th. Nevada is one of the hardest hit states. An industry lost almost 99% of its workforce in one day. The previous record for unemployment in Nevada was 13.7% in late 2010. More jobs have been lost in 1 month than through the entire 2008 recession. Unemployment claims totaled filed in Nevada 480,000, which is equivalent to 31% of the state's workforce. And as an executive director of a nonprofit that assists folks, families when they're struggling, we would typically see 10 to 12 families, maybe in a week or so. We are now assisting 50 families a day. The devastation out there is just, it's hard to relay and it's unimaginable. Today, we're going to hear from experts from NCSL and the U.S. Department of Labor and the National Association of State Workforce Agencies, who will discuss provisions in the federal legislative responses to the pandemic and how states are responding to the crisis on today's webinar. Today's webinar is a platform for information exchange and engagement, and we hope that it answers your questions and provides new information. For questions, please use the chat box in the lower left-hand corner of your screen to submit your questions to our presenters. We encourage you to type in your questions and even if you have answers throughout these presentations. Many of you will want to download the slides for today's webinar. You can find a PDF version of the slides by opening the tab labeled Resources. The tabs are found just above the presentation window. Another tab is labeled Speaker, where you can read the bios of today's speakers. You can access these tabs at any time during the presentation. If you have trouble downloading the presentation, please email Michael Quillen at michael.quillen, Quillen, @ncsl.org, and he will send you the deck of slides. Today's webinar is being recorded and will be available on NCSL's website within the week. The National Conference of State Legislatures is a bipartisan organization that serves the legislators and legislative staff of the states. And I have found it to be exceptionally valuable over the 20 years that I have been in the legislature. Being in a citizens legislature, you need a lot of support from folks. NCSL provides research, technical assistance, and opportunities for policymakers to exchange ideas on the most pressing state issues and is an effective and respected advocate for the interest of the states in the American federal system. NCSL developed an online hub to make its comprehensive resources on state and federal responses to COVID-19 easily available to you. Here you can find podcasts, webinars, reports, and databases addressing continuity of government, criminal justice, education, elections, fiscal, health, housing, and Human Services, and other important considerations during these unprecedented times. Today, we have 3 presenters who will share their expertise with us. Remember to click on the speaker tab to read the bios. We were to have Assistant Secretary John Kalish from the U.S. Department of Labor. Unfortunately, he has been detained, and we will, I believe, have Ms. Amy Simon substituting for him. We will also have Zach Herman of NCSL and Scott Sanders of the National Association of State Workforce Agencies. It's now my pleasure to introduce our first speaker, and thank you so much for stepping in at the last moment, Ms. Amy Simon.
Good afternoon. Thank you for both the invitation and the introduction. And yes, I would be remiss if I did not say that the Assistant Secretary does wish that he could join today, and the department is aware and grateful of all of the work being done in each of your states, and are grateful to be here on the call today. So I wanted to use the first few minutes to just give an overview of both the federal response to the pandemic in the arena of unemployment insurance, and also a few items on the department's agenda as we look towards a return to work as well. So first of all, the word unprecedented has certainly perhaps been overused, but there is no way around the fact that 40 million individuals filing for unemployment in a 10-week period is certainly not something that either the U.S. Department of Labor or states and state departments of labor have encountered. And both the Families First Coronavirus Response Act and 2 weeks later the CARES Act created drastic changes in both the policy and the program implementation in the unemployment insurance space. And the 2 enhancements have made an immeasurable difference in the lives of countless Americans, and so do not understate the significance of those massive changes. And at the same time, fully aware of the combination of massive increases in the number of claims and implementation of new programs. I wanted to note just a few items on the guidance front. Since mid-March, the U.S. Department of Labor, Employment and Training Administration has issued 19 separate unemployment insurance program letters providing guidance to states specifically around COVID topics coming from the Families First Act and from the CARES Act. And so that guidance has been the bedrock of implementation efforts in the states, and we continue to work on clarifying pieces of guidance, new topics or specific issues, so that there is enough clarity about program implementation. The Office of Unemployment Insurance has hosted 14 webinars since mid-March. The department has been engaged with state workforce agency leaders, UI directors, governor's offices, to make sure that both concerns at the state level are being heard at the U.S. Department of Labor, and that all of the assistance that DOL can provide is being provided. And so 2 particular ways in which we have done that are both in ensuring that the funding contained in the Families First Act for changes in staffing and administrative support is provided quickly to the states, and we are almost at the very end of that process. And also a topic that has had consistent attention at the state and the federal level of information technology infrastructure support. So we have facilitated conversations between states and the U.S. Digital Service, which sits within the Executive Office of the President, to provide targeted technological help. Since several states have taken USDS up on that offer and have made significant improvements either in front-end or back-end technology challenges that were causing significant problems. We've also invested in upgrading the ICON system, which all states rely on as part of checking interstate wages, and we have continued to monitor that system and to ensure that it is not providing additional challenges for states. One of the central themes, both in the guidance and in our conversations with states, has been the importance of program integrity. Certainly the pressure to transition to setting up brand new programs and to responding to the massive numbers of claims provided significant pressure on state teams to pivot and to implement these programs. But at the same time, the reality that paying eligible beneficiaries is a complicated process in brand new program implementation does not allay the OIG's fears or others in terms of the ongoing stability of the UI programs that states administer. And so we are continuing to clarify for states exactly what that means on the program integrity front and to provide support where there has been confusion. The last thing I wanted to note briefly was certainly today's jobs report highlighted this, but at the same time that we are still seeing increases in first-time unemployment claims, we're also seeing folks begin to return to work. And I think this morning's surprise of job numbers moving in a positive direction is an indication that the situation will continue to unfold in ways that are perhaps surprising. And the ability of both federal and state policymakers to respond to those unfolding changes will be critical during the summer. One of our themes here has been talking about return to work and the best ways to encourage, as businesses begin to gradually reopen, as stay-at-home orders are gradually lifted, how to encourage workers to return to work, to ensure that workplaces are safe, to ensure that the economy, which was deliberately and consciously slowed to prevent the virus spreading, can be safely reopened. And so one of the things that the two themes that we've had there are the importance of state workforce systems, and often this is a complex set of organizations at the state level, but that the state workforce investments are made in a coherent way and respond to the realities of this year's particular challenges. And we have had conversations with several states about consolidating or streamlining investments either in workforce training and employment services as the partner half to this unemployment insurance crisis. So as millions of individuals unexpectedly and abruptly went on to unemployment insurance, we expect that there will be millions of folks, and we hope that there will be millions of individuals headed back to work this summer, and some of them will need additional skills or support for that transition. And the other item is that we do understand that the importance of responding to business need, and certainly this, the past few months have demonstrated that the employer community and the demand for employees and workers has shifted. Even as many have lost employment, other industries have had significant demand. And so paying attention to and responding to local labor market needs will continue to be an emphasis in how the Department of Labor works with states and with local workforce development boards as well to ensure that supports are given for the millions who we do hope will be returning to work this summer and beyond. And with that, I'm happy to take questions and also happy to share anything with the Assistant Secretary that would be useful.
And thank you very much, Ms. Simon. I do have one question. Being in Las Vegas and with all of the casinos closing, and it was one of my jobs earlier in my life, I did work in one of the casinos. One of the largest concerns that's bubbling up now is everyone wants to go back to work. People were applauding as they were walking into the casinos yesterday, and it took you could feel the level of stress lift in the city as people went back to work and went back into the casinos and customers were checking into the hotel rooms. But there's a real concern that if the virus arises again in the fall and we have employees that are at risk, I know there are some provisions that would help. I know they have to be able, willing, and available to work, but I do know that there is a health concern condition that's encapsulated. I was just wondering if there had been any guidance on that and how the states can address that, because ultimately it's all about employee safety and customers being comfortable coming back into the casino environment.
Absolutely. So there is Unemployment Insurance Program Letter 10-20, which was actually issued the beginning of the crisis in response to conversations with the state of Washington. And so there are clarifications of flexibilities available to states in that guidance that may be useful. So I would point you there for the first, to answer the question first, but we certainly understand that what able and available to work means in a COVID impacted environment has more nuance and complication for employers and employees.
Well, thank you very much. I appreciate that. I don't believe I see any other questions in the chat box at this time. Thank you so much, Ms. Simon, as the Deputy Assistant Secretary. I know you've probably been working nonstop for the last 2 months. Thank you for your service, and we appreciate you being with us today to step in for the Secretary.
Thank you. Glad to be here.
Thank you. Thank you. So our next presenter is Zach Herman, Policy Associate on the Employment, Labor, and Retirement Program in NCSL's Denver office. Zach will be sharing some of NCSL's work and what state legislators are doing to address this issue. Welcome, Zach.
Thank you, Assemblywoman Carlton. So one of the biggest resources NCSL has developed is our organization-wide joint legislative tracking database. So here we're tracking just over 1,800 pieces of introduced legislation across all 50 states related to COVID-19. In that database, you can find bills sorted along lines like health, education, employment, labor, and retirement, elections, a variety of categories across all of our research programs. It's also sortable by introduced versus enacted. Within the labor realm, we're tracking 178 introduced pieces of legislation related to COVID-19 and employment, labor, and retirement. And of those 178 bills, we have 33 bills enacted so far. In this map, you can see that Minnesota and Vermont have the highest amount of bills introduced so far. And these cover topics from unions to workers' compensation, unemployment insurance, licensing in states of emergency, and a variety of other topics. Organization-wide, NCSL is also working diligently to get as much information out as possible related to COVID-19. We've answered over 470 research requests, done at least 18 webinars, 10 podcasts, and published 32 blogs. Within the labor and employment realm, we also are developing new web pages as hot topics emerge. We have a web page specifically related to COVID-19 and unemployment, where we track changes across all 50 states, as well as explain some of the CARES Act provisions related to unemployment insurance. We also have a web page on revised revenue projections for states, and we have an upcoming webinar about manufacturing our way to economic recovery. And then as the pandemic continues to evolve, we'll also develop more resources as we go along. Thank you.
Good afternoon, everybody. This is Scott Sanders. I am the Executive Director for the National Association of State Workforce Agencies. I've been with NASWA for a little over 5 years. I also spent 10 years working at the state of Indiana under 2 governors and headed up the Indiana Department of Workforce Development for a number of years, and I'm also a veteran of the Great Recession, so lived through that time as well. What I thought I would do is just kind of present just some facts and some items that I think will be of concern for state legislators as we move through this process. So this first chart, just to give you an idea, highlights the claims tsunami that really has hit our nation as well as the state workforce agencies in a matter of 4 months. Obviously, the unemployed numbers that came out today, this was an estimate that had been put out, came in quite a bit lower, but I do realize that if you include those that are self-employed, that are out of work, that would probably still get you close to this figure. I wanted to make sure you understood that this rapid wave of claims has become an instant strain on state UI agencies and systems, where they have now staffed up call centers as well as claims processing, postage handling, whatever it may be, to try and meet the claims demand. I also wanted to just highlight a little bit of a forewarning. As individuals move through this process, it will create additional strains further down the line on both appeals as well as in reemployment activities. I kind of have referred this with my staff as the snowplow effect. So what starts here will eventually continue to be pushed outward. Just for a point of reference, the blue line is actually the unemployment during the Great Recession over a 24-month period, where it started out at about 8 million individuals and only rose to about 15 million, and that was its peak during the 24-month period of time. So it was more of a gradual increase and more flatline versus the sheer spike we have right now. What I thought I would do is just kind of give you a little bit of a perspective. The first column is data from January of 2010, the next column from May of 2019, and the last column is from May of 2020. So during the Great Recession, in the first column, the peak number of individuals that were actually paid some form of UI compensation was 12.1 million folks. Approximately 6 million of those were paid regular state UI, which is a calculation based on wages submitted by employers. In addition, 5.6 million folks were paid in a program called Federal Extended Unemployment Compensation, or back then we referred to it as EUC, where individuals that completed their regular state UI could continue on to additional weeks of compensation. Some of that funding and weeks collected were changing based on states' unemployment rate, and back during the Great Recession, claimants could collect a maximum number of weeks of up to 99. In addition, there was a $25 federal additional compensation program that was rolled out as new that ran from the period of February of 2009 to December of 2010. So just to give you a highlight, a year ago, in May of 2019, state agencies only paid 1.6 million individuals in claims. And obviously, agencies were staffed much lower, and also they had fewer challenges with where the economy was at that point in time. So just to give you an idea then, if you just go back to May 16th, states paid almost 30 million claimants with 19 million in regular UI. So that's quite a large increase from a year ago, as well as an additional 10.7 million in a brand new program that came out in the CARES Act, which was Pandemic Unemployment Assistance, or PUA. Just to give you an idea, PUA was enacted to pay self-employed and gig workers on a regular basis, but there was a challenge in calculating their wages without sufficient documentation. In addition, this was then done on a statewide basis. This is a similar program for states that have disasters such as hurricanes, floods, fires, but those are typically geographically centered or regionally based. So this is really the first time this type of program has been laid out nationally. In addition, on top of that, states rolled out a new program, Federal Pandemic Unemployment Compensation, which paid $600 to each claimant, and that is right now slated to end at the end of July. So obviously opening up these new entire state programs such as PUA has been a challenge, especially considering the number of workers that this program could cover. Additionally, another program that will roll into place, and it's got a few folks claiming already, is the Pandemic Emergency Unemployment Compensation, and roughly right now there's about 200,000 individuals collecting. So the maximum number of weeks you can collect now through all these programs is 56 weeks. So it just kind of highlights kind of the tale of two different worlds here. This next chart just touches on federal UI administrative funding. So just as an idea, since the fiscal year 2016, the funding that has gone to state workforce agencies has averaged about $2.6 billion a year, versus the 5 years previously, the amount was roughly $3 billion. In addition, states right now put in about $300 million a year, $300 to $400 million a year of their own state funds to keep UI agencies afloat. So obviously, these low funding levels have created struggles for state workforce agencies to maintain adequate staff in call centers, claims processing, provide needed upgrades on systems, and allow for proper training. So during these extraordinary times now, the burden has become quite overwhelming while staff has been working to handle all these tasks. And it's also important to keep in mind that states are concerned about their own staff implementing virtual work, and obviously everybody's new world of maintaining proper social distance. Just to highlight something that most state legislators, if you've had trust fund issues, have touched on before, these are the various UI trust fund balances across all states. At the end of December, that number was roughly $76 billion. That number is really on a downward slide, where at the end of May, it was roughly $50 billion. As states head into June, states will continue to be paying out claims with little tax revenue coming in. Approximately 65% of state UI tax revenue is collected between January and May. For example, states paid roughly $21 billion in regular UI claims in the month of May alone, and if our unemployment figures stay as high as they are, that will probably continue again in June, so you'll see these numbers drop down substantially as we head towards the end of June. Just as a benchmark, after the Great Recession, there were actually 36 states that depleted their entire trust fund, with the high point of borrowing from the federal government was $51 billion, and that happened in May of 2011. Some states did elect to actually go to the private market to find funding as well. The next chart down below it, I just want to touch on the percentage of decline in trust fund balances since March 31. So states that have seen a 25 to 50% decline, that's roughly 21 states. States that are in greater jeopardy have seen a decline between 51 to 75, and then there are 3 states that have seen a decline since the end of March of over 75%. So that obviously will create some serious issues for state legislators to consider. And as you know, the impact on state businesses is typically determined by an appropriate tax schedule that is calculated on a state's UI trust fund balance, and depending on your state, that typically happens at either June 30th or somewhere between June and September. So this is something that will become front and center in so many state legislative bodies going forward. One of the other areas that NASWA started working on a couple years ago was really assisting the states in fighting fraud. We've set up a UI Integrity Center, and as a piece of that, we actually set up an Integrity Data Hub that allows state workforce agencies to submit their data for us to do cross-matching between states. We provide fraud alerts, so if a state sees a group of claims that appear to be fraudulent, we can identify that, send that fraud alert out to other states so they can go through and start doing their own analytics to try and prevent those. We help them with claims analysis. We also help them with bogus or fraudulent IP addresses as well as international IP addresses that should be blocked, as well as suspicious claims. So as we begin to set up this integrity center, it's been helpful and continues to help the states maintain and try and work on their integrity. It's something that will continue to grow as we go through this year. The next slide I thought I would just touch on is a little bit on the workforce slide. This is data that is put out by the state workforce agencies. It's on what's called a continued claim, so it's individuals that actually collect week after week. And the bars going from left to right are February, March, and then April. And I just want to touch on a couple areas so you have an idea. And this data is available probably in your own state. But for nationally, the yellow area represented food service. So those individuals filing claims made up roughly 5.5% of the pool in February. That jumped all the way to 18% in April. Likewise, healthcare jumped from 6.7% in February to 12.2% in April as smaller offices closed down, as well as surge centers, as well as anything that was considered kind of an optional surgery. The piece that also grew, which is a little bit of surprising, was the combination of retail and wholesale trade went from 11% in February only up to 15.5% in April. And then manufacturing has also seen a decline, going from 10% up to 13.4% in terms of making up the mix. So obviously one of the big questions from a workforce perspective is which of these industries will continue to hire back, how are they going to handle social distancing, and which ones don't end up rebounding coming out of this pandemic. Obviously, these impacted industries are going to create a challenge for both state agencies and employers as they continue to search for talent. And the last slide I just want to touch on highlights also some of the challenges in the workforce. These are the unemployment rates for individuals over 25 by their educational attainment. The blue line is less than high school diploma. The orangish line is high school graduates, no college. The gray is some college, and the yellowish is bachelor degrees or higher. And you can see the severe ramp up in unemployment for those that hadn't finished high school, going from 5.7 to 21.2. Likewise, high school graduates, 3/6, rose to 17.3. And individuals with some college went from 3 to 15%. And even those with bachelor's degree went from 1.9 to 8.4. So obviously these unemployment rates highlight the need for workforce agencies, employers, and training providers to help individuals find new skills, be reskilled, and find a career path that will pull them back into the economy and get America working again. Thank you for your time today.
And thank you very much, Scott, for that excellent presentation. Very, very grateful for the time that you put in on that. So I'm sure that between Zach's presentation and Scott's, there are a number of questions. So we'll wait for a second as folks type in their questions into the chat box. I think I would like to start, if I may, Mr. Saunders. At the very end, you mentioned the training, and that's something that a number of folks here in Nevada are thinking about, because we know as things ramp back up here, we're doing 25% occupancy, then 50%, then 75%. We're going to have a number of folks that may not be going back to work if their venues don't reopen until possibly early next year or even mid-2021. So what have the discussions been about retraining and resources for that, and the analytics of where we think we should retrain people for so that we can point them in the right direction?
That's a great question. I do sit on the American Workforce Policy Advisory Board, and a couple of the issues that have come up in a paper that was put out was on the movement to e-learning, and obviously figuring out which industries are going to grow, what new industries are going to be created. Obviously, there are individuals that have now been trained, and I know there's a group that offers training for COVID-19 tracing for those individuals that may have been exposed and how to track back where they were. So I think a lot of what the trainers across the U.S. are having to do and will be doing is actually switch to more e-learning and online training to actually help those get back into the workforce. I think you'll also probably see a growth in individuals trying to work from home, just as we've been able to operate now, and that will create additional opportunities for those becoming remote employees. So I think that's something that a lot of the workforce agencies, as well as higher ed, have been starting to work with as training providers in converting what used to be in-class learning to now online learning.
Thank you very much. I'm waiting to see if there are any other questions coming up. I don't believe so. We did list all the contact information with the webinar, and this has been recorded, so people will be able to access that and pull the slides down. And I know that our wonderful staff would be happy to answer any questions, and I'm very interested to see how other pieces of legislation work their way through the progress in other states. Nevada being a part-time legislature, we don't actually meet this year, but we will be doing a lot of work to prepare for 2021. So with that, I would like to thank all of our presenters again for sharing their time and expertise with us today on this webinar, and thank the legislators out there for participating. I know your time is very valuable, and our constituents need us a lot right now, so for taking the time today, we appreciate it. Early next week, we will post the recording and slides on NCSL's COVID-19 webpage, and to find the archive, go to www.ncsl.org, click on the COVID-19 resource page, and select the webinar title. Thank you all very much for your time today. Have a safe and healthy weekend. We're adjourned.